The tobacco industry has been targeting the LGBTQ community for decades. Their predatory marketing tactics, from using gay icons to advance their political agenda, to advertising in gay and lesbian magazines, to their presence at pride festivals and gay bars, has ultimately led to the deaths of countless members of our community. The Public Health Law Center team met with the California LGBTQ Health and Human Services Network and asked them about what resources they needed. That conversation led to a larger discussion surrounding what really is best for our community. And we were left with the question, do generic smoke-free policies address equity and work as an approach that best serves our LGBTQ population? The data is there, and it shows that LGBTQ folks use tobacco products at high rates. We decided we needed to educate public health professionals and tobacco control advocates on the history of the insidious tactics of big tobacco and how they have co-opted the gay liberation movement to advance their agenda. This video shares that history and explores upstream policy solutions that could positively impact the health of our LGBTQ community. Throughout this video, the terms tobacco and tobacco control refer to the commercial tobacco industry and not the sacred use of tobacco commonly used by Indigenous and Two-Spirit communities for ceremony and prayer. As I was sifting through the industry documents, I was appalled at what I was finding. It was evident that the industry's targeting of the LGBTQ community, particularly gay men, was intentional and calculated. It made me feel like decisions about what products I should use as a gay man were being made for me by an industry that does not care about how their product will impact my health. As the LGBTQ community has gained more visibility in recent years, the industry's presence has followed suit. Their marketing campaigns have evolved from covert advertisements in select publications to the Project Scum campaign, which stood for Subculture Urban Marketing, with a goal to introduce Camel brand cigarettes to the gay neighborhoods of San Francisco, to now celebrating and embracing queer life in mainstream media. Here are some examples of how they've targeted our community and continue to portray themselves as an ally. The industry started to take notice of the gay community in San Francisco in the 1980s. So we really start to see the industry use this narrative or start to sell this idea to the gay community that smokers' rights were equal to or the same as gay rights. So the industry also realized that they could use their existing campaigns or marketing campaigns and use those to market to the gay community. Take, for example, the Marlboro Man, who was seen as a sexy, hyper-masculine, manly man, and that really resonated with some gay consumers. After we started seeing them take notice in San Francisco, the industry started to promote this idea on a national scale, and they used gay and lesbian activists throughout the country to testify on behalf of their industry-backed bills. There was a prominent gay activist by the name of Jim Foster in the 1970s and 80s, and he was the first openly gay man to speak at the Democratic National Convention. So a real powerhouse in the gay rights movement. And we see the industry continuing these practices, pushing the smokers' rights, our gay rights, it's a civil right agenda throughout the 80s and into the early 90s. And by 1992, we see that the industry, with the help of these gay and lesbian activists, has passed what they called anti-discrimination bills or laws in nearly 20 states. So another time we see the tobacco industry taking advantage of the gay rights movement was during the AIDS crisis in the 1980s. We see that Philip Morris from the documents was one of the first large corporations to pledge money and millions of dollars into AIDS research and AIDS-related causes. But we had to dig and find out why did they do this. And we see that in 1987, the AIDS Coalition to Unleash Power, or ACT UP, publicly boycotted Philip Morris brands, Marlboro and Miller Beer, because of their support, industry's support, of a Republican senator by the name of Jesse Helms. And he was an opponent to AIDS research and AIDS-related funding from the government. This really caught the attention of Philip Morris because ACT UP was such an influential coalition in the 1980s, and it really made them change their mind and say, hey, let's pledge millions and millions of dollars to AIDS-related research, education, and prevention for this community. Philip Morris responded to these activists and started to show the gay community that maybe this is a company that cares about us. Pledging millions of dollars at a time when no other large corporations were doing so was a huge deal. The tobacco industry continued to donate to AIDS-related causes throughout the 1990s, and this really solidified their place as an ally or perceived ally to the gay community. The commercial tobacco industry has a shameful history of aligning themselves as an integral part of marginalized communities. The same strategies the industry has used and continues to use on the Black and Indigenous communities have been replicated to the LGBTQ community. Along with their deceptive allyship, the industry simultaneously targets the community through its predacious advertising in gay and lesbian publications. Their deliberate and continuous exploitation of LGBTQ life attempts to make tobacco use an integral part of identifying as an LGBTQ person. We see the industry doing this in various ways.
The industry is smart. There's a lot of market research that goes into how communities are targeted. I think that one of the reasons that I was ignorant to just that people were still smoking and, the rates and, the targeting of LGBT folks was because of how passive the placement of products are, right? So I never really paid attention to, some of my favorite shows or magazines that I read having these tobacco ads. Like, it never really dawned on me. But now that I've become aware, it's like, it's everywhere. Once you're aware, you can't be unaware again, unless you intentionally want to be.
As the tobacco industry has positioned itself as an ally to the LGBTQ community over the past several decades, it's done so by hosting events at gay and lesbian bars. It's done so by giving away free product. It's really engaged members of the community to speak on its behalf, and it's doing that as it moves into the development of new products.
One of the most well-documented events was the Virginia Slims Legends Tour. And this tour brought together tennis stars like Billie Jean King and gay icons like Liza Minnelli to raise money and funds for AIDS-related research. As this tour traveled across the United States, they really started to solidify their place as a member of the community.
So one of the most blatant marketing campaigns that was geared towards the LGBTQ community was a campaign in the 1990s called Project Scum. Project Scum, where the scum stood for subcultural urban marketing, was focused on the Castro neighborhood in San Francisco, specifically targeting gay men and the homeless population. Basically what this campaign did was try to introduce new products to the LGBTQ community by sponsoring pride festivals and also showing up at LGBT bars and clubs to offer free samples to the community.
So through documentation, we see that a Philip Morris brand, Benson & Hedges, conducted focus groups with urban gay men in San Francisco. And from these focus groups, they realized that they were missing a significant share of the market. And they used terms like sophisticated or men that had disposable incomes that tended to be wealthier. And so they created this marketing campaign around the Benson & Hedges brand that was specifically targeted to gay urban men.
There were ads that targeted and depicted lesbian and bisexual women. And these ads also simultaneously played off of stereotypes of lesbian and gay women, and they depict standards of beauty that were set by cisgender men.
So in 2001, Lucky Strikes sponsored ads with GLAAD, the Gay and Lesbian Alliance Against Defamation. One of these ads in particular that makes me the most angry mentions that whenever someone yells, "Dude, that's so gay," we'll be there. Why this makes me so angry is that the tobacco industry is essentially just using anti-LGBT policies and the discrimination that we face as LGBT people to sell their products to us.
I was shocked at first, but then I got super angry reading this ad. It is essentially equating and putting on the same level coming out, the experience of coming out, identifying as someone who is queer or someone in the LGBT community, however you identify, and it is saying that the ability to smoke is the same thing, which no, it is not. One is something that is absolutely authentic to your spirit and personhood, and the other is an activity or a behavior. And that honestly is the most sickening thing, to co-opt that experience, which can be brutal, it can be amazing, it can be scary, it can be joyful. To put all of that and to connect that with the ability to inhale smoke, this thing that kills you. Being queer and being an LGBTQ2S oriented person does not kill you. That is just you being you. It is the thing that frees you and helps you live a full life. Tobacco is the complete antithesis of everything of what it means to be queer or identify.
For the past several decades, tobacco companies have continued to position themselves as allies and representatives of the LGBTQ plus community. So, for example, Human Rights Campaign has a corporate equality index, which rates companies based on its practices, services, the way it treats its queer employees. And for the past 4 years, it's actually rated Altria, which is owned by Philip Morris, as getting a perfect score in terms of the opportunities that it provides to its LGBTQ+ employees. They also submit what are called amicus curiae briefs or friends of the court briefs in US Supreme Court and other cases in situations that have to do with civil rights, the civil rights of LGBTQ+ folks. They were involved in submitting amicus briefs during the lawsuits pertaining to marriage equality. And so they're really putting themselves out there as spokespeople on these issues and using the community effectively to sell its products, to continue to market itself.
The narrative that the tobacco industry has kind of adopted for the LGBT community and saying, we're here for you, it's almost predatory, right? Because it's like, okay, you expose us to these products, you tell us, this is something that you should use, but you know that this is a dangerous product. So how are you here for me if you are introducing me to poison and you're trying to make me become addicted to said poison, right? So it really is predatory nature, because once you're addicted, then what, right? You're saying that you're here for us, but does that mean now you're going to pay when I have emphysema or I have lung cancer? Are you going to pay my funeral costs when I die, an untimely death? What does you being here for us truly look like, right? And that's how it's predatory, because it's all about how can I lure you in, infiltrate your community, and then I'll leave you and abandon you, right? To now deal with this addiction.
Over the past several decades, we've actually seen on a population-wide basis a pretty meaningful reduction in smoking rates. But when you drill down into the data, you see that those reductions have not occurred equally across all demographics. Smoking rates have not decreased meaningfully in the same way amongst the LGBTQ+ population. And then if you disaggregate data within that group, you see pretty different statistics. So we're seeing evidence of the success that the industry has had in targeting the queer community because the smoking rates are so much higher.
There needs to be a shift from a punitive model to a wellness model when we talk about tobacco usage. Because I think a lot of times when we think about getting people to stop smoking, we think about, well, how do we punish them? How do we make them see that this is such a bad thing and it's going to kill them? And I think we have to change our conversation and what that looks like to really introducing them to wellness and what does it mean to truly be well? Because a lot of folks who are using tobacco are people who have experienced something and are using that as a crutch. So how do we change that conversation? What do we give people in terms of resources? Does it mean us having classes and courses, at places where gay folks frequent? Does it mean making sure that our bars and our pride festivals are not funded by the tobacco industry? Does it mean us being honest and saying, no, we do not want your products or your money, but instead we want to help people to become well?
So some upstream solutions that we have for battling tobacco rates in the LGBTQ community definitely stem a lot from the stigma and discrimination that we face as a community. So by increasing cultural competency, including LGBT people in tobacco prevention work, also coming from a lens of trauma and mental health, would definitely improve a lot of our rates. Another really great upstream solution would be to especially fight these anti-LGBT policies that aim to limit the access to care for LGBT people across the country. And so even though policies surrounding sports teams and bathroom bills seem like they're not connected to tobacco prevention at all, we know that they do have a huge impact on mental health, and that mental health does have a huge impact on whether or not someone uses a tobacco product in the future.
There's a role to be played for policy solutions that address the sale of tobacco products specifically. Rather than just address where the products are sold or how they're sold, what can we do to reduce the susceptibility of especially kids and queer kids
to using tobacco products. You know, there's certainly a social role to be played, and tobacco companies kind of facilitate that and sell that aspect of tobacco product use. I think also really making sure that folks in the commercial tobacco control community understand that it's not so much just about passing smoke-free policies all the time. It's not so much about just restricting the sale of these products. It's also about providing really robust mental health support, robust education for folks, understanding more about the queer community, making sure that we're also providing culturally competent cessation tools.
Fighting anti-LGBT policies and increasing LGBTQ plus cultural competency can and will help us to achieve health equity for our entire community.
Because of the predatory targeting of the LGBTQ community, it's no surprise that LGBTQ folks use commercial tobacco products at high rates. The Public Health Law Center is committed to advancing policies that include provisions to support the LGBTQ community. Banning flavored tobacco products, including menthol, supporting commercial tobacco-free pride events, and restricting where and which products are sold are policy strategies that aim to reduce usage and change the cultural norm the LGBTQ community has with commercial tobacco. Now that you know the history of the manipulative tactics of big tobacco, we call on you to reject the prejudice of the commercial tobacco industry and reclaim the pride experience for what it's meant to be, a celebration of queer life.